Go. Hello, my name is Bryson, and today I'll be demonstrating an intramuscular injection. So prior to this, I've already performed the proper hand hygiene techniques. I washed my hands, and I'm wearing the appropriate workwear. I have a gown, I do have a face mask, and I have gloves situated on the table right here. So prior to this, I already grabbed the medication from our medication box, and I compared it with the MAR. I do know for a fact this will be the right medication that we need today. I do know that this is the right patient. Today we'll be working with Tran, who is experiencing confusion and agitation. And lorazepam will kind of reverse those effects, or sort of ease those effects, actually. And I do know of the dosage. We'll be administering 0.5 milliliters of the medication today. And I do know of the right route. This will be an intramuscular injection. And time, this will be a one-time thing, all right? So I'm gonna go ahead and introduce myself to my patient real quick. Hello, Ms. Tran, how are you doing today? Doing good? Perfect, all right. And before I get started, may I please have a name and date of birth?
To be honest, I forgot when I...
All right, perfect. Okay, so today's procedure is going to be relatively easy. We're going to be injecting you with lorazepam, which is a medication that will kind of help ease your agitation and confusion, because I do know you get a little bit angsty when we're trying to work with you. You know, sort of alleviate those effects. And I do know for a fact there's going to be some side effects you're going to be feeling, usually dizziness and nausea, but that's going to be expected. But before we get started, is there any known allergies that you want me to know about? No? Perfect. Okay, so there's no allergies. And is there a place you want to get poked at today? Your deltoid. Perfect. All right, so I'm going to go ahead and raise you up to the appropriate level so I can see you real quick.
Speak up. They're loud.
What kind you want? There's
Let me go ahead and adjust your pillow real quick. More comfortable right there for you. Perfect. All right. So now to the appropriate level a little bit. Let's go ahead and take a look at that site of injection that you want. Move your pillow out the way real quick. Perfect. All right. So usually for deltoid injections, you want to go ahead and measure 3 fingers right below the acromion process. It's going to be right there, and you're going to go ahead and inject right below that. So it's going to be below this finger right here. Yeah, sorry. Below this finger right there. Okay? So right there. Okay. All right. So now that we have the site of injection ready, or at least assessed, we're going to go ahead and prepare our medication. And first, I'm going to go ahead and perform hand hygiene. Now that we have some hand sanitizer on, we're going to go ahead and put some gloves on as well. So now that we have our gloves on right here, let's go and prepare the medication itself. So I have an alcohol swab that I'll be using to sanitize the top of the vial, so it's free of any bacteria, anything that can hurt you. I'm going to go ahead and wipe the top off, usually for like 10 to 15 seconds. Just go ahead and let it dry for a second and go this way. Alright, so now that we clean the stopper of the vial, let's go ahead and prepare the syringe for withdrawal. Alright, I'm going to go ahead and grab this syringe right here. This is a 3 milliliter syringe, and I also do have the fill needle, which we'll be using to withdraw the medication. Okay, set it there for you. And we're going to go ahead and attach that fill needle to the syringe. Throw this away. Alright. I'm going to go ahead and pull the needle using the double OK method, just like that. And we're going to pull out the same amount of air that we need for medication. So in this case, it'll be 0.5 or 1/2 of a milliliter. Alright, so now that we have that, we're going to go ahead and insert the needle, just like that, into the vial. And we're going to go ahead and inject the air into it. And we're ready to pull it back up. Pull it right below the liquid, and we're going to go ahead and start pulling out the medication.
Is that like literally this? I think we learned it as... I think it's... We did the room.
Okay, perfect.
Wasn't as often as we
There we have that. It's going to get rid of any air bubbles that are present in the needle.
The guy that did the online tour thing that we listened to talked a lot about.
Okay, perfect. So I got that rid of. It's going to use the scoop method to kind of recap the needle just like that. Perfect. All right, and we'll be going ahead and getting rid of this needle. Put it on the table for a second. I'm going to go ahead and grab our syringe, our actual needle that we'll be using for injection today. Just sort of tap that on right there. Throw this away. Then we grab our old blunt fill needle and put this into the shoes box, just like that. Right, now that we have the syringe ready for injection, we're gonna go ahead and prepare the site of injection. Okay? So I'm gonna grab the second swab. And prior to that, we're gonna go ahead and check the medication here just to make sure. Right. Usually you want to go ahead and do that before you want to inject, of course. But now that we checked it again, we do know that this is the right medication. All right, so as I was saying before, you want to go ahead and prepare the site of injection using an alcohol swab, of course. I'm going to move your panel right back real quick, Ms. Tran. Right. Usually you want to go and start inward and move outward, just like that. Let the air dry for just a second. I'm going to throw this away. Okay. Right, so now that we have that ready, we're prepared to start the injection. Same thing as the blunt fill needle. We go ahead and pulling out the cap just like that using the double OK method. And we're going to pull back the safety mechanism. All right. So of course now we know what the site of injection is. We go ahead and support arm right here. And we're going to hold the needle as if it was a dart and just quickly insert there and slowly inject the medication. Perfect. Leave it in there for a couple seconds. Once it's done, I'll pull it out real quick. And I'm gonna put the safety mechanism on. Grab the old cap. Back in. There. And we're gonna assess the site for any bleeding. We'll just say there's a little bit of bleeding. All right. Now, usually in a medical setting, we'd want to discard of this into a paper towel, throw the paper towel away, and put this inside the sharps box. But today we won't be doing that, okay? So as I said before, she's bleeding a little bit. We'll go ahead and put a Band-Aid. It's a bit hard to pull out. There we go. Other side. All right. Simple application, usually. I'm gonna pull this out real quick. Oh. Usually it'll come up properly. So we'll go ahead and apply the Band-Aid just right there. Site of injection. All right. And now you're good to go, Miss Tran. All right. So please feel free to call me if you feel anything that's out of the normal. I'm going to reassess you real quick, make sure you're comfortable again. Yeah, but as I said before, please let me know if you feel anything that's out of the norm. Use your call bell. I'll be happy to come by and check on you, okay? Just going to fix this real quick. Perfect. So as I'm lowering the patient, after this, I'll go ahead and document the administration of the lorazepam in the document, and we'll call it a day. And that is the conclusion of my IM injection.